Improved Healthcare for Patients with Limited English Proficiency by Lexi Fouch. Outline: the problem, solution proposal, dentistry, LEP patients. The problem. Language barriers pose significant challenges in the U.S. healthcare system, particularly for individuals with limited English proficiency. There are approximately 25.6 individuals with limited English proficiency in the U.S., and this number is increasing. This is a crucial problem with the healthcare system. Language barriers have a big influence on the standard of care limited English proficiency patients receive. According to the paper Caring for Patients with Limited English Proficiency, the perspectives of small group practitioners reported that 47 million residents speak a language other than English at home, and almost half of them speak English less than very well by the U.S. Census definition. The use of qualified translation service in healthcare settings is a full answer to the problem of unfair patient care, as the research suggests. Problem statement. In the U.S., language difficulties in the healthcare system are a major issue that result from subpar treatment for a large portion of the population. Current regulations and practices are insufficient to address the barriers that LEP individuals receive to healthcare access and outcomes. A higher risk of medical errors, problems, and worse health outcomes arise when patients with limited English proficiency are unable to completely comprehend their medical issues or treatment plans. With limited English proficiency, people see doctors less frequently, are less likely to have regular healthcare providers, and have lower rates of preventative screenings. The reason this is important is that proper diagnosis, treatment, compliance, and general patient's happiness all depend on efficient communication. Why? Providing limited English proficiency patients with superior care can be achieved by removing language barriers through the use of knowledgeable translation services. It should be clear to us that in order to ensure that every patient receives fair and efficient treatment, that current healthcare system needs to be modified to suit the needs of linguistic population. A focused effort is required to ensure fair access and results from healthcare due to the gap in patient care. Translators. To narrow the communication gap between LEP patients and healthcare practitioners, I suggest implementing a professional translation service in healthcare settings. This entails employing qualified interpreters for the languages that LEP communities in different parts of the country speak the most frequently. By doing this, we can guarantee that LEP patients receive the same caliber of treatment as the patients who speak English, thus enhancing the quality of healthcare given to these patients. Effects. Language barriers have detrimental effects that go beyond simple discomfort, that they cause serious health inconsistencies. Patients who don't speak English well are more likely to have misconceptions about their medical diagnosis, treatments, regimens, and prescription guidelines. These misconceptions may lead to disregard for medical advice, which could have a negative impact on one's health. For example, a LEP patient might not comprehend the significance of taking a prescription drug at a particular time, which can make the treatment ineffective. According to the study by Keller at 2007, LEP patients are less likely to understand discharge instructions, lead to higher rates of readmission and longer hospital stays. Continued. Misconception can also result in the improper use of medication, as demonstrated in Flores' 2006 research, which found that LEP patients were at higher risk of adverse drug reactions due to misunderstandings about dosage and administration. Language obstacles might also cause delays in care. Reasons. Fear not being understood is a common reason why LEP patients put off medical assistance, which can accelerate illnesses that could have been treated sooner. Because they struggle to interact with medical professionals in an efficient manner, LEP patients also endure increased levels of stress and worry. Delays can result in serious health problems and higher medical expenses. These outcomes demonstrate why healthcare settings require professional translation services. LEP individuals with incorrect diagnosis, insufficient treatment, and worse health outcomes in the absence of good communication. In order to guarantee patient safety and high quality care, it is imperative to address language obstacles. Thus, having equitable healthcare access requires integrating extensive linguistic support with the healthcare system. Solution: a language interpreter. A thorough framework for incorporating qualified translators into medical teams is included in the proposal. Supporting information. Translators will be accessible via telehealth services for smaller or remote clinics and on-site at a larger healthcare facility. This dual strategy guarantees that LEP populations living in remote regions can benefit from better communication. This arrangement guarantees accurate medical communication for LEP patients worldwide. We accomplish this by employing telehealth, hiring translators and training interpreters, and stationing translators on site. We pick translators carefully, providing them with excellent training and integrating them into the medical teams to guarantee that patients with limited English proficiencies receive adequate care. We will eliminate barriers related to distance by utilizing telemedicine for smaller clinics and having translators on site at larger ones. It matters because everyone, regardless of language, should have access to high-quality healthcare. Research indicates that this method is effective in enhancing patient comprehension and contentment, so we can provide LEP patients with the care that they require by concentrating on translator quality and technology. Raising awareness. Increasing language access. Increasing the public of private sector's assist for LEP individuals will also result from increasing awareness of the healthcare and inequalities they encounter. Government funding in collaborations with philanthropies and community organizations can help pay for expenses for hiring translators. The why. Reducing discrepancies in care requires greater focus in medical training and education to improve healthcare provider communication with patients of all ethnic and cultural backgrounds. Raising the required level of awareness and support requires education. Healthcare practitioners ensure that translation services are available to serve as a variety of patient populations fairly by fighting for skilled translators, which promote inclusivity in healthcare for all. Providing trained and medical interpreters to LEP patients has shown to significantly improved patient satisfaction. Ultimately, lowering medical errors brought by the barriers will also result in lower healthcare expenses. This is because there are fewer errors due to the clear communication. Patients and healthcare professionals may communicate more effectively when interpreters are present, which improves diagnosis and treatment. This lowers the possibility of medical errors brought on by language difficulties and increasing patient satisfaction. In the end, these advancements can reduce healthcare expenses by averting issues and needless surgeries. Dentistry. Language limitations also have a significant impact on dental care, as demonstrated by the difficulties California dental school students confront. Making sure dental care providers have access to qualified interpreters can help to increase patient satisfaction overall, decrease errors, and facilitate communication between patients and providers. This is in line with a more comprehensive plan to incorporate expert translation services into all healthcare environments, ensuring that all patients, regardless of language ability, fair in excellent care. Language barriers have an influence on patient happiness, communication, and the possibility of medical errors being reduced. LEP patients that suggest approach on offering qualified translation services in medical environments will greatly raise the standard of care patients who are limited in language proficiency. The ultimate objective is to eradicate inequalities based on language and have cultural competency, which will raise the value of healthcare in the U.S. overall. Thank you for listening. And these are my references.